Hello, good morning, good afternoon, good evening everyone. Welcome to the 84th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Happy New Year po ulit sa inyong lahat at maraming salamat po for being part of our credible online community. To all those who have just discovered us for the very first time today, welcome po. And I'm sure magugustuhan nyo po ang aming mga pag-uusapan not just for today but for all of our future webinars. Around the world, countries are expanding vaccination against COVID-19 to include children. May mga early reports na po on the variant such as Omicron pointing to more cases among younger age groups but this still needs further study. May mga ilan din po mga bansa wherein concern about childhood infections of COVID-19 has prompted quick rollouts of vaccination programs for children. In the Philippines, the Food and Drug Administration has approved the use of the Pfizer-BioNTech vaccine for children ages 5 to 11 years old. Local government units, schools, parents, and families are preparing for a possible implementation starting in the first week of February. So if you are looking for the latest science-based and evidence-based information from the most distinguished experts, keep it right here. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date. And always looking forward to Fridays po because I get to share hosting duties with our adjunct research faculty, also the Special Envoy of the President for Global Health Initiatives, ang aking partner, Dr. Susie Pineda-Mercado. Dr. Susie?
Hello, Raymond. Good afternoon, good evening, kung saan man kayo naroon. And hello, partner. Kamusta na?
Okay naman.
Nako, magandang topic po natin ngayon. We'll be talking about vaccination for children. Actually, we've done this before, Raymond, no?
That's correct.
We've talked about it, but now, andito na. Okay, so nandito na. At sigurado ako marami kayong mga katanungan. We hope that today will be a very enlightening webinar for you. Lahat tayo matututo sa ating mga dalubhasa, our experts who are here with us today. Raymond has mentioned that several countries are already vaccinating their children. And I think we'll hear a little bit more about that from our speakers. We'd also like to welcome all of the members of the Pediatric Infectious Disease Society of the Philippines, PIDSP, that's co-sponsoring this webinar. So we welcome our pediatricians who are experts in infectious disease. Sama po kayo sa discussion mamaya, baka meron kayong mga gusto idagdag o gustong itanong. Makakatulong po yan ng malaki sa ating audience. So welcome everyone and stay with us. We've got a very exciting topic today. Raymond, over to you.
Thank you, Dr. Susie. We always start po by putting our discussion into context by presenting po what we call the person on the street video that's weekly prepared by TVUP. For this week's person on the street video, the question that we pose to the person on the street essentially, may alam po ba kayong mga pamilya na kahit mga bata ay nagka-COVID-19 na? Sa tingin po ba ninyo ay dapat bakunahan na ang mga batang 5 to 11 years old? Please watch this.
May mga alam po akong pamilya na ang mga anak ay nagka-COVID.
Right now, my daughter is COVID positive. She's 8 years old. It's pretty mild. She just had fever for 1 day. Then after that, wala na.
Before kasi, nung nag-celebrate kami ng New Year sa parents ko, sa side ko, hindi rin namin alam kung saan niya nakuha. Pero ang alam namin, usually 3 days lumalabas yung sintomas kapag na-expose kayo. That day, kinagabihan, doon lumabas yung sintomas ng anak namin.
Sa aking pananaw bilang isang magulang at isang social worker din at isang development advocate na rin, lalo na sa rights and children's rights, sa tingin ko nararapat na mabakunahan din yung younger children, no, yung 5 to 11 years old.
Definitely. Kasi wala silang protection against COVID. So, any vaccine na pwede sa kanila is very appreciated.
Since meron po akong 7 and 5 years old na anak, pumapayag po ako dun sa mabakunahan sila. para makapag-move on na rin and maprotektahan po yung mga anak ko. Since ako, fully vaccinated, gusto ko rin na ganun sila.
Siyempre, yung ganong pananaw ay dapat back up by proper science, no? Siyempre, inaasahan natin na yung bakuna ay dapat dumaan sa maayos na testing, sa maayos na pag-aaral.
Sana maayos nilang mai-distribute yung vaccine natin. Sana yung procedures nila, especially bata, marami yan. Maayos nila in such a way na hindi nagka-crowd sa vaccination sites.
Gusto ko na mabakunahan din ng mga kabataan na mas bata. Bilang magulang din ako ng younger children dun sa age range na 5 to 11 years old.
So I guess it's a good start also for 2022 na even though nag-COVID tayo, hindi naman tayo tinamaan ng masama.
Almost 2 years na rin pong nasa bahay yung mga bata para makagala na rin po sila at maiwasan din po yung na-stress sila dahil nakakulong sila sa bahay.
Thank you very much, TVUP. It's always great to see what ordinary people are thinking. And I'm sure for you in the audience, meron kayong mga anak o mga apo o mga pamangkin. Ako nga, yung apo ko last year, nag-COVID positive. He was 7 years old at that time. And, you know, it's a scare. It's really a scare for the family. So I know many of you have children in the home and lalo na yung frontline workers natin, you're exposed. So minsan nag-aalala din, di ba? Parang baka mauwi nyo at baka mahawa ang mga bata. So today, pag-usapan natin yan at pag-usapan natin yung protection na mabibigay ng pagbabakuna and what kind of preparations are being made para maging maayos naman. Kasi narinig nga natin sa ating person on the street, no? Mukhang maraming gusto mong pabakuna pero gusto na maayos. Walang siksikan, malinaw kung paano gagawin and all of that. Anyway, I really appreciate that TVUP and salamat sa mga pumayag na mag-on-cam na mga magulang to give their opinions. So Raymond, over to you.
Thank you, Dr. Susie. So ito pong pag-uusapan natin, not naman limited to just 5 to 11 years old. Obviously, we'll be touching on the 12 to 17. But for the most part, we want to be able to put out a webinar that's really geared for pediatric COVID-19 vaccination. And this is for all of the 2,100 plus registrants for this webinar. And as you all know, our webinar can accommodate up to 3,000 participants po. So please join us in the Zoom para po you could experience fully ito pong ating interactive program. If you're watching in YouTube and Facebook, you probably may have a little bit of a different experience compared po dito sa ating Zoom. So hopefully you'll be able to join us in the Zoom. But we have prepared din po questions for you to be able to participate. Not just those who are in the Zoom via the Zoom poll, but for those in YouTube and Facebook via Mentimeter. So for our Mentimeter for this week, we have 2 questions as always, but the code for this week will be 3197713. That's 3197713. You just enter www.menti.com into your browser and then the code so that you'll be able to participate sa ating fun quiz or ating pre-test if you will. For all those asking, ang ating po mga certificates of attendance, medyo dahan-dahan pa rin po natin siyang sinisend out. Especially for webinar number 83. Ito po yung last week, January 14th. Marami na rin po ang nagtatanong. Ito po ang itsura ng ating electronic certificate of attendance that will be received and will be issued to those who have attended at least 50% of the webinar duration. Dr. Susie?
Yeah, Raymond, I just wanted to greet all of our NCR, not just the NCR health workers, but all our health workers who are currently in the hospital. So we can see in the chat, they're actually watching from the pharmacy, from the ward, and so on. And we know na it's tiring and it's difficult, but andito pa rin tayo, no? We carry on and I hope that today, yung time na yung lunch break nyo, nakasama nyo kami dito, ay meron kayong bagong matututunan. And of course, some of our regulars, Raymond, are always eager for the Mentimeter, no? They want to join the quiz. So anyway, binabati ko lang, no? Also, all of our colleagues who are working in the provinces. So I saw here we have our usual community watchers, yung mga nanonood na sa Davao, sa Puerto Princesa, sa Osamis, no? Talagang nagpapasalamat kami dahil kung hindi sa inyo, wala naman kami dito. And we hope na talagang makakatulong yung ating topic today. Tsaka, as I mentioned, magaling po ang ating mga speakers. Sige, Raymond.
Thank you, Dr. Susie. For today's webinar, especially for those who are joining us for the very first time, kasi napansin po namin, those who have been asking for certificates, ngayon lang din po nakasali, we will have a standard panel discussion format. That's for the most part our format for special topics such as this one, and especially for touching about COVID-19 vaccination program. So after all of our speakers have presented, we have a reactor for today from the Department of Health, and then that will be followed by a Q&A session where we'll be entertaining questions, not just in Zoom, but for those na ilalagay nyo po siya sa comment section po ng Facebook o ng YouTube. We try to monitor them as much as possible and then try to ask them po as part of our Q&A session. We also, kung mayroon po kayong makitang a small notification asking you to open your cameras, and especially if you're willing to be a part of the live audience who will be asking a question to any of our resource speakers, sana po paunlakan nyo po kami at makasali po kayo sa discussion. So to get this webinar started po, no, and set the tone for our discussion, we are very, very honored and pleased to have the president of the Pediatric Infectious Disease Society of the Philippines, none other than Dr. Ann Bunyi. Dr. Ann Bunyi po. Ma'am?
Hi, good afternoon, Raymond, at magandang tanghali po sa lahat. Sa ngalan ng PIDSP, ako po ay nagpapasalamat sa nag-organisa nitong palatuntunan upang mapagbigyan at talakayin ang pagbabakuna laban sa COVID-19 sa kabataan. Halos nasa pangalawang taon ng pandemya at batid nating lahat na ang target ng COVID-19 ay matatanda na nagdudulot ng matinding karamdaman na maaaring humantong sa matagalang komplikasyon o di kaya'y pagpanaw. Nung wala pang bakuna laban sa COVID, puspusan naging abala ang pamahalaan, lalong-lalo na ang DOH, gawa ng mga polisiya at panuntunan upang maiwasan ng bilis ng pagkalat ng virus. Ngunit mabilis gumalaw ang virus, ang dami niyang tinamaan, napagod ang mga doktor, nurses at iba pang mga healthcare sa paggagamot at pag-aalaga sa mga nagkasakit. Nahawa na rin sila at kinakailangan na ding gamutin. Yung iba nga tuluyan nang nawalay sa hanay natin. Dumating ang mga nabuhayan lahat ng loob. Inunang bakunahan ng mga healthcare workers, ang mga seniors natin at yung may mga comorbidities. Nakakalungkot lang kasi halos mag-iisang taon na tayong nagbibigay ng bakuna. Marami pa rin. Ngayon na lang na naghigpit ang pamahalaan, nagsisipagtakbo sa vaccination centers para magpaturok. Nakakamanghang isipin na magpasa hanggang ngayon, ang COVID-19 sa mga bata ay nananatiling banayad, maliban na lamang sa mga batang may mga underlying medical illnesses at sa mga batang nagkakaroon ng komplikasyon na tinatawag nating multisystem inflammatory syndrome in children or MISI. Dahil sa Delta variant, umakyat ang mga kaso sa mga bata at marami sa mga batang edad 12 pataas ang naospital. Upang mabigyan na rin ng proteksyon ng mga bata, noong Oktubre taon, sinimulan ang pagbabakuna sa mga batang may edad 12 pataas gamit ang bakunang Pfizer at Moderna, mga bakunang may pahintulot ng ating FDA na magamit sa nasabing edad. Dahil sa hindi magandang karanasan na nangyari sa pagbabakuna laban sa dengue, masusing pag-iingat ang mga ginawang proseso ng DOH sa pagsisimula ng bakunahan sa mga bata. Sinimulan sa mga piling ospital upang masubaybayan ng maayos ang kanilang magiging reaksyon sa bakuna, lalo na't binigyang prioridad na unahin ng mga batang may comorbidities. Nagulat ang karamihan dahil halos walang ininda ang mga batang nabigyan ng COVID vaccine. Malayo sa mga reactions na naramdaman ng mga matatanda nang nagsimula tayo ng bakunahan sa kanila. Sa ngayon, panibagong variant ang kinakaharap natin. Ang Omicron na liksi at mabilis kumalat. Umaakyat na naman ang kaso ng COVID sa mga bata. Napupuno na naman ang mga ospital na nangangalaga ng mga bata. Napapanahon lamang na talakayin ngayon ang inaprubahang pagbabakuna sa mga bata simula 5 taon upang mapaghandaan ang pagbibigay nito habang hinihintay ang pagdating ng bakuna. Tulong-tulong tayong makiisa sa mga kinauukulan, tulong-tulong tayong kumilos upang may dagdag tayong mabisang sandata para sa mga bata laban sa COVID. Magandang hapon po ulit. Maraming salamat po.
Thank you. Maraming salamat po, Doc Mean. President po siya ng Pediatric Infectious Disease Society of the Philippines at napakahalaga po ng papel na ginagampanan ng ating mga professional societies katulad ng PEDSP sa pagbibigay ng linaw, ng liwanag sa ating mga doktor at sa publiko, no, tungkol sa ano ang dapat gawin. At maganda po ang tema. I thought it was very inspiring. And again, I'd like to greet and congratulate all of the members of PEDSP who are with us on the webinar. So Raymond, over to you. I think you're going to do your fun quiz now.
That's true. So may we enjoin our more than 1,000 participants po in the Zoom and obviously more in the YouTube and Facebook po to participate in our opinion poll. Sa mga nasa Zoom po, lalabas po sa inyong opinion poll 2 questions. But for those sa Menti, ito may sumagot na po pala.
Raymond.
Yes,
meron
yes.
pa rin nagtatanong ng Mentimeter. I-post lang natin uli sa chat.
Okay. Monica, can you, thank you. Thank you.
Just
The
put it back
code
on
for
the chat.
Mentimeter, I think there are those who are asking. Okay.
Okay,
So
thank
may
you.
mga 90, almost 100 na po na sumagot sa Mentimeter ng ating first question. Dito na rin po sa ating Zoom, a little over 200 are answering. The first question reads, sino ang dapat mauunang bakunahan sa mga bata na 5 to 11 years old? The options are batang may mga comorbidity. Number 2, batang mga anak ng frontliners. Option 3, batang nauna sa listahan ng LGU. And option 4, batang mga pumapasok sa eskwelahan. So yun po ang 4 options po para sa ating first question. Binabati rin po.
Raymond.
Yes.
Di ba isa lang ang sagot na tama? Kasi napapaisip ako dyan sa tanong mo eh.
So, well, multiple choice po. Pwede po pumili ng I think more than one correct answer at least for this question po. But for the other question, isa lang po ang kasagutan. Okay.
Stricto talaga to si Raymond. Stricto. Sige. Game.
So, we'd also like to greet those who are joining us from Benguet General Hospital, La Trinidad Benguet, from the Department of Education in Batangas, Calabarzon, from Tinambak Municipal Hospital in Camarines Sur, from the Cebu South Medical Center in Talisay, and Camp Navarro General Hospital in Zamboanga City and Zamboanga del Sur. Okay, for our question number 2 reads, alin sa mga sumusunod na bakuna ang aprobado ng Food and Drug Administration para sa mga batang 5 to 11 years old? So, ang options po are Pfizer-BioNTech, option 2, Moderna, option 3, AstraZeneca, option 4, Sinovac. So, nakikita naman po natin kung
cute graphics.
Kung saan po sila mas nag-gravitate po, no? Please take note, the question is for mga batang 5 to 11 years old. So, binabati rin po namin ang mga nanonood po sa atin internationally from the National Center for Global Health and Medicine in Japan, from the Chonin Hospital in Taipei, Taiwan, Hospital Pontian in Malaysia, from Bangkok, Thailand, from Kanto City in Vietnam, University of Hail, Saudi Arabia, Lunichi Ali, University of Blida II in Algeria, the University of Fiji in Lautoka, Rutherglen in Virginia, Stockton, California, from the Bronx in New York City, St. Catharines, Canada, from Soyo in Angola, and from Panketal in Germany. Maraming salamat po. We will not be closing our opinion poll as we move on to our webinar proper for today. Dr. Susie?
Hi, okay, thanks. Thanks, Raymond. Okay, let's go straight to our first speaker. And he's one of your favorites. Kilala niyo po siya. I guess he doesn't need an introduction. He's the director of the Knowledge Management Information Technology Service of the Department of Health. And he's been with us on the webinar a number of times, and we always like to have him here. We're delighted when he's here kasi napakahusay po niya magpaliwanag. At saka parang pag may mga tanong kayo, nasasagot niya kaagad yung yung mga questions niyo. So we'd like to welcome none other than Dr. Eric Tayag. Eric, welcome to the webinar.
Magandang tanghali, Susie. Magandang tanghali, Raymond, at sa lahat po na nanunood, nakikinig sa programang ito. Magandang tanghali po sa inyong lahat. Babatiin ko na kayo ng Happy New Year na na-sandwich sa nakaraang Happy New Year at kung ay fat choice sa darating na New Year naman, yung Chinese New Year. Umpisahan na po natin at akin na pong i-share ang aking slides. Dali lang po at gagawin natin slideshow. Nakikita na ho ba? Hindi pa.
Yeah, you had it for a moment. You had it for a moment, Eric.
Ayan. Kita na ba?
Yes, sir.
Okay.
Wow,
sige.
gumagalaw-galaw pa. Okay.
Okay, ingat kayo. Baka mabasa kayo. Okay. Okay. So, coming soon in a good place near you, COVID-19 vaccination for children 5 years to 11 years. Yan po ang topic natin ngayong hapon. Okay. Dito po sa inyong screen, pinakikita namin the number of COVID-19 cases and deaths as reported by the World Health Organization. This is by weeks. The confirmed cases as of January 17 has already reached over 326 million and the deaths over 5.5 million. The case fatality rate is now at 1.7%. Here we show you the top 20 in this slide. We show you the top 10. The United States ranked number 1 with over 64 million cases, and the deaths have now reached in the United States more than 843,000. Globally, I have already reported to you. In this slide, we show you also the number of persons fully vaccinated per 100 population or the percent. The United States, even though they have ramped up their vaccination, is at 61.55% for persons fully vaccinated. The next slide shows you where the Philippines ranks. It's at number 20 with over 3.2 million cases and deaths of over 50,000. The persons fully vaccinated per 100 population in the Philippines in this report is placed at 47 per 100 population. The Philippine Statistics Authority is sharing with us today, and I'm sharing with you the preliminary results of the leading causes of death for 2021. They don't have the numbers yet for December, but as of 2 days ago, the leading cause of death is ischemic heart diseases, but COVID-19, that includes both the confirmed and probable COVID-19 cases, is now the second leading cause of death. over 99,000 reported. Please contrast this to 52,000. The Department of Health only reports confirmed cases of COVID-19. Now, what do we know about COVID-19 in children? Just like adults, everyone or every child is susceptible to COVID-19. The incidence in children is similar to that in adults despite low risk of exposure, or even because of infrequent testing to confirm diagnosis. And we know the reason why. Sinabi nga kanina ni Dr. Bunyi, banayad, kaya malamang sa hindi. At sapagkat sanay na tayo sa mga batang sinisipon at inuubo, hindi tayo magsususpecha na COVID pala yun. Up to 18% ng laboratory confirmed cases are children. Ito ay base sa pag-aaral na ginawa sa maraming bansa. The number of reported COVID cases in children are underestimated. Pinaliwanag ko nga dahil nga banayad po yung sintomas at malamang sa hindi po na-test. The incidence increases with increasing age. Ito rin po ang nakita nila sa mga pag-aaral. COVID-19 infections in children occur following household exposures. So kung ang tingin po natin ay baka sa eskwelahan po, lalo na sa mga bansa na nagbukas na ng paaralan, marami pa rin nagkakasakit ng mga bata sa age group na to sa household exposures, lalo na kung merong adult na index case sa household na yun. Yung secondary attack rates, ang taas, more than 75% ang naobserbahan. Yung transmission from asymptomatic children, na-report na yan. So kahit walang sintomas yung bata, pwede siyang manghawa. Reinfections, pwede rin mangyari. The risk factors for COVID-19 in children include may infected household member, tumanggap ng bisita, at may gatherings na ang mga kasama ay hindi naman yung mga kasamahan nila sa kanilang bahay o tahanan. In settings where face-to-face education is allowed, alam nyo ba that children can get COVID-19 not because they attended the school, but because the inconsistent mask use. Asymptomatic infections can range actually from 15% to 42%. Ang laki, no? And children have similar symptoms as adults, except that frequency varies. Typically, fever, chills, cough. Pero kanina binanggit, nakakatakot yung multisystem inflammatory syndrome in children or MISI, na parang toxic shock syndrome yon, parang yung Kawasaki. So yan, may rashes, namumulay yung mata, at maraming mga organs ang naapektuhan. Yung underlying conditions have higher rates of hospital and ICU admissions. So kung may comorbidity, manumang sa hindi yung bata ma-hospital at baka ma-ICU. Most children with COVID-19, nakaka-recover naman sila in 4 weeks. Although it's rare, children in this age group can die. Children will be susceptible to long COVID. So 3 months later, after na makarecover sila, they still have symptoms or there will be new symptoms, and this will last for at least 2 months. That's long COVID. Here we show you the percentages or proportions of children. We divided the age group differently so that you can see how it differs from one region to the next. And so our age grouping here includes 0 to 4, 5 to 11, because that's our topic today. So this is a special presentation for you for the age grouping 12 to 17, 18 to 24, and so on. Let's look at the 5 to 11. Overall, 4% of the total that have been reported will belong to the 5 to 11 years old. But look at the Cordillera Administrative Region. It's 5% higher than the national average, and also Region 2. That's the Cagayan Valley region. Now, maybe you want to ask, were there deaths among this age group, 5 to 11? Yes. The total number of cases reported in this age group from January to December last year is over 100,000 cases, and there were 133 deaths, or 0.1% as our case fatality rate. The UNICEF reported just recently that at least 463 million children worldwide were unable to access remote learning. So if everybody thought, parents out there, that you are all right, your child is one of those lucky enough to be recipients of remote learning, it is not so for millions of children worldwide because of school closures. Now, benefits versus risk. In October 2021, the Global Advisory Committee on Vaccine Safety concluded that in all age groups, the benefits of the mRNA COVID-19 vaccines in reducing hospitalizations and deaths due to COVID-19 outweigh the risks. You can have many references, and I'm citing that the most recent one that I got from the New England Journal of Medicine pertaining to an evaluation of the Pfizer vaccine, BioNTech vaccine in children 5 to 11 years of age. Their conclusions: a COVID-19 vaccination regimen consisting of 2 10-microgram doses of this vaccine administered 21 days apart was found to be safe, immunogenic, and efficacious in children 5 to 11 years of age. But wait, the World Health Organization cautions everyone. Let's look at what the caution is all about. The World Health Organization says that because of supply constraints on COVID-19 vaccines, the focus should be actually protecting populations or subpopulations at highest risk of hospitalizations and deaths. The question is, are children belonging to the age group 5 years, 11 years, are in these subpopulations? What do you think? Another one, the WHO says that countries with few or no vaccine supply constraints should consider the issues of global equity when making policy decisions about vaccinating children and adolescents. Translation: many countries have not actually started their first doses for their citizens, or even if they did, it's only marginal. Many are still ramping up their vaccination to at least achieve the 40% fully vaccinated target of the WHO by end of December last year. And now the WHO has a new target, 70% by end of June this year for all countries in the world. Now, there's another thing. Although the safety and effectiveness has been proven in many studies, the stringent regulatory authorities that provide these indications should be followed through, and that the maintaining education for all school-age children should be an important priority this pandemic. And so this is therefore one of those indirect reasons why vaccination should be considered in this age group. Now, let's look at some of the countries where COVID-19 vaccination has started already for children 5 to 11 years old. There's the United States of America, Canada, Spain, Italy, France, and in this part of the region, China. And of course, over there, there's Venezuela, there's Oman, Saudi Arabia, United Arab Emirates, and of course, Singapore. Now we show you here, for example, in Spain, they start in January, they're now picking up, they're now at 40% for the 5 to 9 years old. But what is happening around the world? Now, in Abu Dhabi, you do not need an appointment for your children for the vaccine. They're using Pfizer. In Canada, everybody was surprised because Newfoundland managed to vaccinate 75% of 5 to 11 years old. And they say the magic formula included clear communication, speedy mobilization, and a culture of vaccine acceptance that's so high in repeated surveys. In China, they called on the little inoculated warriors as they ramped up their vaccination for children even younger than 5 years old. And of course, in Singapore, they have already achieved 11.4% vaccine coverage for this age group. In New Zealand, there is buzz because some parents are taking government to court to stop vaccine rollout for kids, even though the survey says that close to 70% approve of vaccinating children in this age group. And the CDC in the United States, serious problems, rare in ages 5 to 11. This will provide confidence in vaccinating children 5 to 11 years old. In the Philippines, do we have plans for vaccinating children 5 to 11 years old? On your screen, the target for the 5 to 11 years old is 12.5 million, maybe more. This can reach up to 16 million perhaps. And the Department of Health and with the other agencies are anticipating in these proposed timelines and milestones that primary series will be done starting the first quarter of 2022. We're excited if it happens next month. And of course, this will include boosters as well for these children. Now, exactly how are we getting ready for vaccinating these children? One, in December 23, the FDA issued an emergency use authorization to Pfizer that will be used for children 5 to 11 years old. The PPS-PIDSP has actually published a joint position statement on this. But the Health Technology Assessment Council has yet to issue their guidelines, so this is pending. The NITAG guidelines are also pending. The NVOC, the National Vaccine Operations Center guidelines are also pending. The procurement of these appropriate Pfizer vaccines, because they will come in different formulation, is also pending. But the town hall meetings for healthcare workers have been scheduled this month. Next month, the social mobilization is planned, and I hope local government units are implementing this already. Pre-registration is ongoing, at least in the city of Manila. Signing up of vaccine team volunteers is ongoing, perhaps in many areas still, not necessarily for the 5 to 11 years. And social media postings are being prepared, or if not, they are in your social media platforms. Now, should we prioritize? Let's look at intently on what the joint statement I mentioned about from the Philippine Pediatric Society and Pediatric Infectious Disease Society of the Philippines. In areas with reported heightened local transmission, prioritizing eligible 5 to 11 children who belong in the A3, those with comorbidities. Remember which ones you chose in the opinion poll? A1, children of healthcare frontliners. And of course, they caution implementing agencies that due diligence must be applied to ensure vaccine equity and access. Now, yes, we know, mother knows best. How can we prepare getting children ready for the jobs? Kailangan maganda tayo ilang araw bago natin sila dalhin o kaya may bumisita para bakunahan yung mga bata. Kailangan maintindihan ng mga bata na ito ay proteksyon para sa kanila at sa mga kasama nila sa bahay. Kasama na rin kung mga kalaro nila kung balang araw magbabalik ang paglalaro sa ibang bata. Yung unpleasantness ng first job, yung turok o kaya yung kurot dyan sa braso, ay baka hindi sila bumalik. Kaya yan, pinaliliwanag po namin yan. At syempre, paliliwanag natin ng maayos po kung tayo ay nagpapaliwanag sa isang magulang, yung mga doktor po, kasama ko rito, ay hindi dapat tayo nagmamadali. Talagang bibigyan natin ng konting panahon o sapat na panahon para maipaliwanag yung mga pag-aalala, takot, agam-agam ng mga magulang. Siguro mas maganda kung may mapapakita tayong litrato, video para naintindihan po nila. At wag nating sabihin turok, siguro sabihin natin pisil, may pisil para na sa bakunang tatanggapin po nila. Paano kung yung bata dinala na ngayon at mababakunahan sa mga bakuna center? So, kailangan mawala yung pansin nila sa bakuna, so gagawin tayo ng mga gimmick dyan. Siguro pasasara natin yung mata nila. At siyempre, pag kasama yung magulang, lalo na katabi nila, mababawasan po yun. Baka may ice pack kasi yung iba sensitive, nasasaktan talaga. Baka para sa may isang yung sakit po na mararamdaman nila. O eto hindi to suhol talagang bibigyan natin sila ng mga bagay-bagay na ikatuwa po nila. At parati po dapat may mask katulad ng nakikita nyo po sa screen po ninyo. At paalala po natin katulad ng ginawa sa CDC kung anong dapat asahan sa mga batang nabakunahan po. So, tatanungin namin kayo sapagkat nang binigay po sa akin ang topic na po ito, inaasahan sana namin na meron na pong guidelines. Dahil wala, ito mga katanungan natin. Kailan tayo dapat mag-umpisa? Kailan nga ba mag-antay muna tayo at alamin natin kung anong nangyayari sa ibang bansa? Saan tayo mag-uumpisa? Sa high-risk areas ba? Ano ba ang talagang target natin? Lahat ng bata o may comorbidities lang? Sino pwede magbabakuna? Yung pharmacist ba? Pwede na? Lalo na ang mga butika kasama na ngayon sa pwedeng lugar magbakuna. Bagamat ngayon po, 18 years old and above lang ang pwede sa mga butika. Paano po kayong mga sa private sector, mga pediatricians, mag-volunteer ba kayo? Hindi ba kayo natatakot na baka mahawa po kayo, lalo na kung marami yung babakunahan? Saan tayo magbabakuna? Ibabalik ba ng DOH yung door-to-door? Eskwelahan, maraming sarado po yan. May ibang lugar ba? Kailangan pa ba ng appointment? Talaga, kailangan pa ng appointment. Informed consent, hindi ba to pahira para makumbinsi sila? Baka mag-isip yung magulang, ba't may informed consent? Mag-iisip sila tuloy. So baka i-delay nila yan. Paano yung mga bata sa ospital? Babakunahan ba sila bago umpis ng ospital? At paano naman po yung mga bata na nasa household? Sabay-sabay silang babakunahan. At yung boosters dapat na bang ihanda? At syempre, ibibigay ba ibang bakuna para sabay-sabay na? Kaya nga, tatapusin ko po ang aking pakikipag-usap po sa inyo. Gawin nating maganda ang kinabukasan ng mga bata. Tayo naging bata rin. Sana malasa po nila ang magandang bukas. Maraming salamat po. Magandang hapon.
Thank you very much, Dr. Eric Tayag from the Department of Health. As usual, an excellent presentation, very comprehensive. Dami pong laman nung sinabi ni Doc Eric. Eric, meron tayong mga questions na sa Q&A box. You might want to answer them and even on the chat, but you can see how our audience is appreciating your presentation. So maraming salamat, Dr. Eric Tayag, sa mga paliwanag. At I think maraming parang you made a lot of things very, very clear. So I think we'll proceed. So Raymond, over to you.
Thank you, Dr. Tayag. Our next speaker naman po, also another familiar face to everyone. She is a consultant with the Department of Pediatrics, specifically with Division of Infectious and Tropical Disease. Please welcome again to the webinar Dr. Marimel Pagcatipunan. Dr. Rajing?
Hello, good afternoon, everyone. Thank you, Dr. Eric, for the very engaging, kasi ang galing nung sir, explanation niya for the vaccination in children. So my task for this afternoon is actually to share with you, baka nga po kayo matakot, yun lang ang our experience in PGH regarding COVID-19 infection in children. So this would actually, I just want to show you the picture of the COVID infection in children in PGH. So since PGH has been designated as COVID referral center for Manila, and since last March of 2020, so halos magto 2 years na po tayo ngayon. So in pediatrics, we had our own COVID ward, initially just for 9 to 12 beds because we thought that COVID or SARS-CoV-2 is an infection for mostly for adults. Okay. So we also have our neonatal ICU COVID area for those babies who are born to COVID positive mother. So for this afternoon, I will show to you slides on our experience on pediatric COVID management, and then just a few slides on their vaccination status of these patients, and also share with you our experience when we did the vaccination for the adolescents, and then some of my recommendations. So our data show the in PGH, so I divided it April to 2020 when the COVID started to December of 2020, we had a total of 114 cases. In PGH, we don't admit mild asymptomatic or mild cases if it is just for COVID. But some of these cases may be admitted because of some other problems. Okay. And we started during that time, the start of April, to do the PCR test. But remember, during the first half of the pandemic, we just have several laboratories that can do the PCR. So as you can see, our probable cases, so these probable cases, the pink one or the red ones, are actually, they have presentation for COVID infection but are negative in the PCR test. So they are defined as probable cases. The blue ones are the confirmed cases, which means they have the clinical and the laboratory finding of COVID infection in children. The MISI that was actually mentioned earlier, we also received them, but we only admit patients who are on the severe to critical cases because we can actually manage them, most of the COVID infections in children at home, because if they are mild, we just send them home after. So these are the admitted patients. So as you can see, when we had the surge for the adults initially, in 2020, that was in July to September, we also have surge of pediatric cases, and they are also being admitted for severe case. And then another surge that started by December of 2020, and then another surge on March to April. This was the South African variant. And then the Delta variant and surge was August and September to October. And then, unfortunately, again, the January is the Omicron surge. So in our hospital, we had peaks again of cases. So by age, the probable cases which were seen last year were actually mostly on 2 to 5 years of age. Okay, but for the confirmed cases, majority are actually on the adolescent cases. So that's from 11 to 19 years of age. And in this graph, you can see, as you can see, there's male predominance. I don't know why. Yes. Okay. So for the classification of cases, as I told you earlier, the asymptomatic cases are the ones that are admitted for other causes. For example, trauma, burn, or for surgical cases or emergencies. And because our policy in the hospital is that we do all swab all these patients and do PCR test, so we can actually cohort them. So if and classify them is if it is COVID or non-COVID. So these asymptomatic cases being admitted were actually those who just need other or being managed for other problems. But we have several, or majority of our cases are actually moderate to severe, and these are the ones who really had the COVID infection. Now, for admission per month, this is just for last year. I have this reported that the severity of the disease, this one, are also they are increasing every time we have the surge. So like this one, the April, and then the August to September. Okay. And the outcomes actually are very good in children. Majority would recover and be directly discharged from the COVID wards. Okay. But we also have some mortalities. And these are the ones who came in on their severe to critical stage of the disease. Now, for the comorbidities, almost more than half, about 60 to 70% are actually with comorbidities. Like majority would be your hema-onco cases, followed by neurologic cases and cardiac cases. Okay. But about 38% from our data, 38% of these children do not have comorbidities. So they are apparently well and then had COVID. So most common symptoms on admission would be difficulty of breathing or respiratory distress, okay, fever, abdominal pain, and definitely the coughing. And in children, they usually have vomiting and diarrhea. We also observe that in the different types of the surges, for example, the early surge, first surge for the COVID infection, majority would actually present with respiratory distress and fever. In the Delta surge, we have seen that they have more fever and coughing and respiratory distress. Okay? And now in the Omicron surge, we have fever and diarrhea. Okay? But most of them would still be admitted for pneumonia. Okay. I just want to share with you that those babies born to COVID positive mothers, okay, from PGH, our experience, for the year of 2020, we only had 4 positive babies. We do PCR tests for all babies born to mothers with confirmed COVID-19 through PCR tests. They may be, majority of these mothers are actually asymptomatic, but we have some who are also having moderate to severe COVID during delivery. Okay, the discrepancy in the number of the mothers and the babies because some of the babies are twins or triplets. Okay, so and we do the swab of these babies within 24 hours of life, and if they are positive, we repeat them again after 24 hours and observe these babies. If they remain positive on the second swab, we isolate the baby. If the result is negative on the second swab, then we do DRI this baby, direct rooming in. And majority of these 7 cases for the last 1.5 years they are actually asymptomatic and are well. Now, in PGH now we have the Bayanihan isolation ward for COVID patients. So we transferred there last year of October, and this is dedicated for COVID infections. So the 42 beds are now all in the start of January are already uh, on full admission, and we have increased our COVID beds initially from the 15, as the initial limit, but we are now on 25 to 28 beds and even more. So the challenges for January actually is that our doctors and nurses and even all the other staff are also getting sick themselves. About half of our resident manpower actually were all positive for COVID this January. So the manpower and also the facility capacity is one of the challenges. So for January, I would just like to show to you that on this graph, that starting the January 1, so you look at the red and the violet line, which shows the moderate to severe critical types of patients. So we have that shifting. So at the start of January, we only have those who are asymptomatic or admitted, COVID confirmed by PCR, and admitted for other problems. But now, we are receiving the moderate to critical cases that are now again due to COVID. So, vaccination status of all these pediatric patients, definitely the 2020, there's no vaccination for anyone, even for the adults. But in 2021, we started vaccinating the adults. And last November, we started vaccination of the teenagers or the adolescent. But all these patients that we receive since December to January all have no vaccination at all. And this table, I just want to show to you, that the Pfizer vaccine that is allowed to be given to 5 to 12 years or 11 years of age is different from the one that is being used for the adults and the adolescent. So as Dr. Eric Tayag have said, and I hope it will be available by next week or the next weeks, because we have to wait for this one. Now, our experience for the vaccination of adolescents, so that it can also be part of the guidelines for the vaccination of 5 to 11. So we started last November. The process was well received. We call all our patients. We started with those with comorbidities. And we do text them. We use the Google Forms. Marami na po sa kanila mga parents, they really know how to answer the Google Forms. And then we sent them the informed consent and everything. And we have very, very few adverse reactions reported, even fewer pa nga po kesa nga sa adults. Okay. But the challenges remain that, number one, these high-risk patients with comorbidities, yung may mga cancer po, di ba? Or meron silang cardiac problems, with that last November, only about 50% gave their consent and got their vaccine. So the reasons are actually the parents' fear for possible side effects because their children already have illnesses. Okay? They cannot accompany the child because in vaccination of children, adolescents and children, it would involve the parents. Unlike in adults, they can go by themselves. Next would be the child does not want. No, the parent may want to vaccinate the child, but the child doesn't want to. Okay, and the parents themselves are not vaccinated, so they don't want their child to be vaccinated. Another challenge is for these high-risk patients or those with comorbidities. We recommend longer observation time for them after the vaccination. The original 15 minutes observation, we extended it to 30 minutes. So because we might see, no, yun nga po, to look out for some possible side effects. So it may have some crowding at the monitoring areas. So that is one of the recommendation. So are we as the vaccinators, we in the government, no, and also are they ready, the patients themselves, the parents, no? Number one, the vaccine availability. Okay. Number two, the patient and the parent readiness to accept this vaccine, no? And the awareness that the vaccine can give, the benefits. And then iba pa rin po yung nandun na, yung the day na magbabakuna na, pupunta ba talaga sila? And can they go to the facility? Some of them, they don't have the pamasahe, no? The transportation. Okay? And lalo na nga po ngayon, paano natin sila palalabasin? Di ba? Now, the third would be, we have to give them accessible facilities to be able to increase the uptake of the vaccination. Okay. So, with that, I would like to thank you and please keep safe, everyone.
Okay, thank you very much. That's Dr. Jing Pagcatipunan. Maraming salamat, no? And thank you to all our doctors from PGH. Makikita niyo po na talagang pinag-aaralan lahat ng mga pasyente, ito, mga pediatric patients natin, no? They're really studying trends, tinitingnan nila kung ano talaga ang nangyayari. Kaya, parang maswerte tayo na sila Jing Hindi na natutulog yan si Doc Jing Tama ba yun? Kasi talagang nagbabantay sila, pinag-aaralan nila. And I think we all benefit from this very close observation, very scientific approach, no? Parang hindi haka-haka lang, tinitingnan talaga nila kung anong nangyayari sa bawat pasyente. Yun ang ibig sabihin ng pinag-aaralan, no? Parang very serious, we take it very seriously. So thank you to Jing, to the pediatric group, and to the Philippine General Hospital. Raymond, did you have a comment before we go to our next speaker?
No comment. I was just looking at the presentation of Dr. Jing, especially on the vaccination status. Kaya ano pala siya, tinatrack pa rin pala.
Grabe, ano? Kaya sabi ko nga, parang, mahusay talaga. Mahusay tayo dito sa Pilipinas. We really have very good experts. We're really studying things very seriously. So, kakayanin natin to. Talagang parang, syempre, pag nakita natin yung mga numero, tapos sinabi nga ni Dr. Jing na puno yung ICU ngayon, parang nagkaka-moment ako. Raymond. Kasi sabi ko nga, meron akong apo So, it becomes a little different when you think about it. But the good news is that most of them are getting well and that we know more about how to manage these cases. So, okay. So, let's go to our next speaker. We have a reactor from the Department of Health. Mapalad po tayo. Kasama natin ang Director ng Disease Prevention and Control Bureau of the Department of Health. We'd like to welcome Dr. Razel Nika Hao. So, Dr. Hao, welcome to the webinar.
Thank you, Dr. Susie and Dr. Raymond, for extending the invite again to DOH now to discuss naman po what we have to expect in the coming weeks, given all of the things that were discussed earlier. So I have a couple of slides, really mostly just to summarize and inform kung ano po yung mangyayari in the next couple of days, especially in terms of vaccinating now a younger population group for COVID-19. So I think we all know naman po na currently the Philippine government has made sure that we have access to vaccines in the country, starting from the adults, wherein we had 8 types of vaccines so that we could implement appropriately. The past couple of months, we have also rolled it out to the 12 to 17. And what we're anticipating to start very quickly is now this vaccination program, extending it po to the 5 and 11 years old. So as mentioned earlier, sa FDA po, they have authorized the use of the Pfizer vaccine for this younger age group. But as mentioned din po earlier, no, magkaiba itong formulation nitong pang-younger pediatric age group versus the other Pfizer vaccines. No? Basically, the main difference is a dilution o parang mas onting amount of the active substance yung ibibigay po to the younger age group. And all of this will be part of the trainings that will be done to the implementers on the ground, no, when we start the rollout. Visually din po makikita natin yung difference, and this will be the ones that are for the 5 to 11 years old will be through a vial na orange yung cap para hindi po tayo magkaroon ng mga issues or confusions regarding kung ano yung appropriate na Pfizer vaccine to provide to this age group. Yeah. So also, as I mentioned earlier, when the parents will go to the vaccination sites, they will be expected to show some proofs of relationship to the child, no. Meron naman pong maraming pwedeng sources of proof. If possible, to bring birth certificate, that's usually the best evidence. But there are also in our guidelines other list of possible evidences. And then of course the IDs, and during the screening, mai-explain po doon yung what the process will be, yung pagpipirmahin po kayo din ng consent form, at saka yung child po ay papabigyan din natin ng assent or parang pumapayag din siya, no, na mabakunahan. After of course na ma-screen ng mga health workers natin on the ground yung eligibility po ng ating pediatric population to be vaccinated. So very quickly po, this rollout will be starting by the end of January. So actually that's really the next couple of days po, you'll expect a lot of news about this. It will be through a phased approach. First starting with select sites in the NCR. And this is usually naman po how we really roll out new groups, no, and new vaccination plans. Tina-try out po muna natin to a smaller sample, and then very quickly and naman po ay ina-expand na rin po natin to other parts of the country. So to make sure nga po na hindi magkaka-mix up on the ground, the recommendations we'll be giving the implementers are to have dedicated sites or dedicated teams and even dedicated days po, no, para we lessen any chances of giving out the wrong vaccine to the recipient. And all of our implementation plans have been adopted based on the many learnings that we've had from vaccinating the adults and vaccinating our older pediatric groups. No? So next week, please expect that the DOH will be releasing the guidelines, especially for our implementers. Trainings will also be happening next week, including site inspections and site preparations, and a lot of similar activities like this, wherein you will have discussions with the public, no, on how they can access all of these vaccines. So really just a reminder po and a call to everyone here, this vaccine is an additional tool, no? Katulong po natin yan to really make sure we can go back to all of our usual and essential activities as a society. All of these vaccines have been assessed by the FDA and even by our expert groups to be safe and effective, and the government is providing them for free. No, they have shown really to give out a lot of benefit in comparison to risk, and to have this protection for having severe na disease. No? So the way to access them would be through your sites, such as the LGUs and the hospitals, and you can sign up through the mechanisms available to this. But as a reminder po to everyone that isang tool lang po itong vaccination. No? So even after vaccination, we should all remember to implement all of our minimum public health standards, lalo na dun sa mga high-risk na settings, no, yung closed, o kaya mga indoor, yung crowded, dumadaming tao, at saka yung mga close contact, o yung lalo na yung nakakahalubilo kayo sa mga ibang tao outside your household. No? This should always be implemented with masks, with distancing, yung paghuhugas ng kamay, at yung pag-make sure na we have adequate ventilation or airflow. And as a special reminder po to everyone, especially as we start vaccinating our kids, to make sure that we also protect them from the other diseases. No? So, of course, not at the same time, but this is just for a reminder to make sure na yung marami po tayong ibang sakit din na pinapabakunahan, lalo na sa ating mga bata. So, make sure that we don't forget, no, that vaccines in general protect against severe disease and death. And that includes vaccines for all diseases and vaccine for COVID-19. Thank you very much po.
Thank you very much. That's Dr. Nika Hao of the Department of Health. Very informative, straightforward information about the vaccination process. So at this point, we'd like to call in all of our guests to open their videos. So Dr. Hao, Doc Jing, Doc Eric, okay, so, and Doc Mayan, okay. So we will have our panel discussion, but before that, Raymond will go into a public service announcement.
Thank you, Dr. Susie. Before we go into our Q&A session, we'll just take a very quick break for a special public service announcement today. Over to you, TVUP.
Sigurado ka na ba sa reservations natin?
Oo naman.
Bakit bihis na bihis ka?
Oo, magiging escort mo ko eh.
Mukhang may date si Lolo't Lola.
Ilagay mo kaya ito?
Ang ganda naman.
Maganda yan. Special ang lakad natin. Ano, ready ka na?
Ready na. Mom, Dad, aalis si Lolo't Lola. Oo, anak, after lunch. Sa nalakad niyo po. Para sa atin lahat ito. Magpapabakuna kami dahil mahal namin kayo.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you, TVUP. The COVID Communication Public Service Announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by the UP Vice President for Public Affairs, Dr. Nenny Pernia, and funded by the DOH-KMITS and the Department of Health through the AHEAD HSPR project. Dr. Susie?
Yeah, thank you very much, Raymond. I think, you know what I want to do, Raymond? Kasi ang daming specific questions sa Q&A box.
Yes.
So instead of going into very general questions, what I'd like to do is to pick up on each of the questions on the Q&A box and some of those that are in the chat because they're very specific and I think people can learn a lot from the specific questions. So, Raymond, pick upin kaya natin yung mga nasa Q&A muna.
Okay.
Isa-isahin natin sila kahit na hindi upvoted. We have time Kasi sabi ko maraming questions na magaganda.
No problem, no problem. We also have a few more questions coming in from the comment section. So we'll try to pick them up kung wala daw po ito. Kung wala po ito, hindi po sila nailagay sa Q&A section.
No,
this question comes in from Caroline Butler. Question reads, and this is our most upvoted question. Knowing that most children aged 5 to 11 have a robust immune response, what would be your advice regarding the timing of the vaccine if the child got infected in this last surge? Do we have any information regarding reactions to the mRNA COVID-19 vaccines among 5 to 11 years old, especially for those who got Omicron or other variants? Maybe we could ask... Go ahead, sir.
Okay, the current recommendations for those who have been exposed or infected is that they have to complete the period of quarantine or isolation. And as soon as they have recovered, which is described as having at least being without fever for at least 24 hours and improvement of respiratory symptoms. Otherwise, vaccination can be delayed. So as soon as you finish your quarantine or isolation, you can actually get vaccinated. And now, if there are any qualms about this, these are recommendations not only from the Department of Health, but from other authorities as well. Thank you. Over.
Okay. Raymond, kunin ko yung top question natin, no? From Dante Morales. For
Okay.
12 to 17-year-old who had Pfizer vaccination 5 months or more before, can they get the Pfizer booster, which is the same dose for the adult in the country? Does DOH allow this? Can they get it during Pfizer vaccination for adults? Thank you.
Okay. Doc Nika, I think yeah, you will be with me on this. Ang alam ko, wala pang schedule for boosters for 12 to 17 years old. Even though lampas na sa 5 buwan from their second dose. Not unless you can share, Dr. Nika, any news about this, if 12 to 17 can be included in the booster doses?
Yeah. Ang rejoinder ko po dito is we are currently following what is allowed by the FDA emergency use authorization. No? So for now, what the FDA allows is a booster for the adults. But tama po, that will actually be something we should expect. No? Siguro the answer lang is at this point, it's not yet allowed by our FDA and it's not yet part of the implementation plan. But that is, of course, something that will happen in the near future. Thank you.
Raymond, go ahead.
Thank you, Dr. Susie. There's a rejoinder from Caroline Butler. So the recommendations have been made based on past information on adults. But she's asking about children regarding, especially information regarding reactions to the mRNA vaccines among children, and if there's any information among 5 to 11, especially because there are issues from the past with regards to the dengue vaccine po. Maybe we could ask the opinion of PEDSP, Dr. Mean. Any information po on adverse reactions among the 5 to 11 sa mRNA vaccines po?
Thank you. Thank you, Raymond. So we just have data based on the phase 3 clinical trial which was done for Pfizer in children aged 5 to 11 years old. And dun sa datang yon, ang nakita lang nilang most common reactions were vomiting and fever. Okay? I know everybody is a little bit anxious about the myocarditis, which is a rare adverse event which has also been an issue in children aged 12 to 17 years old before Pfizer was rolled out. So this is the same issue among 5 to 11 years old, and this usually happens on the second dose. But comparing this adverse reaction between these kids, there were less number of myocarditis events in the 5 to 11 years old compared to the 12 to 17 years old.
Okay, thank you very much.
Raymond, Susie, Raymond, can I add something to that?
Okay.
In my presentation, the New England Journal, their study, there were no cases of pericarditis, myocarditis that were reported following COVID-19 vaccination with the Pfizer-BioNTech. Thank you. Over.
Okay, thank you for that. All right, we have a question from Emma Lianto. I know the current recommendation covering interval between COVID vax and routine vaccines. Is it still 2 weeks? I don't know who wants to answer this, Jing, or maybe...
Let's ask DOH, Dr. Nika, for that.
Nika.
Yeah, so our guidelines are similar to the adult. We still recommend 14-day interval for vaccines, and mostly it's because of we want to check kasi kung may adverse effect, no? Para hindi rin ma-confuse na yung reason for an adverse event is a different vaccine from the other. For now, we do that, but actually some sites are also authorized naman po to implement kunyari a shorter interval if they deem necessary from their physician. So baka ma-explain din po ng ating implementers. Thank you.
Okay, Nika, I have a follow-up question to that because I heard you saying na baka kailangan magpakita ng birth certificate. Hindi ba pwede yung vaccination card nila sa EPI?
Meron po Dr. Susie na list of possible alternatives. I'll have to check that card from the EPI as a source. But hindi naman po yung lang certificate yung required. Actually, other IDs and other proofs are allowed. I think kasama po nga yung mga ganyang documents. But I'll have to check lang. Thank you.
Okay, thank you very much, Nika. Raymond, ano pang napili mong question dyan?
Our other most upvoted question comes from Florence Alzate. The question is, in case of adverse events, can the parents of the children expect assistance from the government? DPCB again.
Ako ang taga-sagot. Yeah. So in the vaccination program, our financing support is for kunyari kung sakaling kailangan ma-ospital, no? So there's a PhilHealth package to support any hospitalization necessary. There's also a separate adverse event following immunization benefit if it comes to have more severe presentations, no? So the support is through there, and of course lahat naman po ng, especially those who receive severe adverse events, after investigation nare-refer yan po to our hospitals and to our regional offices who facilitates as much as they can whatever is needed by that specific case. Thank you.
Okay, thank you. There's a question here from Cheryl Sacro. Do we have a new DOH template for medical certificate for patients with comorbidities in the age group 5 to 11 years old? Kasi sabi natin, unahin yung may comorbidities tsaka yung mga anak ng frontliners, no? So is there a template for that? How is that? How is that going to be managed? Anyone?
Yeah, so sa guidelines po natin, it will include vaccine-specific and age-specific health screening form. Yung medical certification po kasi we don't require that naman for everyone, no? But there are certain diseases wherein we require the certification. We don't have a standardized template. But that certification has to include that the doctor recommends that that child will have the vaccination.
Okay, so
For those situations. Yes, thank you.
So any recommendation of a doctor na may comorbidity yung bata, pwedeng unahin yun?
Yes.
Susie, yes, we did that with the adolescent vaccination, that there should be a recommendation from the pediatrician for those with comorbids. So I think we'll still have to follow that. Gusto ko na mag-comment again, ma'am, yung balik lang ako dun sa isang comment kanina na about the vaccine after a disease, no, yung mga ganyang cases. Because this vaccine is under special, diba, recommendation. So and it's available in the government. So yung the principle, no, kasi po kami on the side of PEDSP, we also have the other vaccines recommendations, di ba? So we follow the principle of vaccination. But for this COVID vaccine, we have to follow our government recommendation. Kasi lagi kaming natatanong dyan eh. Kasi it's a program. So para hindi na ho tayo magkagulo-gulo sa mga natin, we follow the government recommendations. Yun lang po.
Okay.
Thanks.
Thank
Raymond,
you.
go ahead.
Thank you, Dr. Jing. Since we have you, we have a question coming in from Dante Cecilio Valdez. The question reads, is it rational to give COVID vaccine to cerebral palsy pediatric patients? Do we still require them to be cleared by their PEDIA prior to vaccination?
Yes. All patients with comorbid, they have to be cleared by their pediatricians or those who are looking at or taking care of them. And it is recommended. The only
Okay.
contraindication for not giving a vaccine, is if you have a adverse ano yun, severe reaction from that vaccine, and that's the only contraindication. So
Ayun.
all the rest pwede naman po.
Opo. How about this question, Dr. Jing, from Riva Dara Abundo? If a child is exposed to a COVID-19 positive family member and develops the same symptoms but is not tested for COVID-19, how many days before he or she can get the vaccine?
You finish the recommended isolation or quarantine. So yung meron na po tayong guideline for that. So again, katulad din ng sinabi ni Dr. Eric kanina, di ba? When you got the disease, or even if, kasi high risk na siya, exposed na siya sa household. So again, and develop the symptom, di ba? So again, follow the isolation or the quarantine days before they would go for vaccination.
So what is that? What is that number now? Kasi that has changed, di ba? Eric, ano ba yung number mo? How many days?
Okay, so kung unvaccinated ka or partially vaccinated lang, ang quarantine mo ay 14 days.
Okay.
14 na araw. So imo-monitor mo yun araw-araw. Kaya nga inihikayat namin na yung hindi magpapabakuna, kasi kung bakunado kayo, mas maigsi po yung quarantine po.
Okay, so Eric,
Salamat
after the 14th day, pwede na magpabakuna yon.
Oo, kasi ibig sabihin nun, yung quarantine niya, hindi siya nagkaroon ng symptoms, most likely hindi siya nahawa. So, pwede na siya magpabakuna.
Okay, good. Okay. I have a question here, Raymond, that I thought was interesting.
Sige po.
If there, ito. This is probably for Jing, no? Pagkatipunan. I would like to ask, this is from Joanne. I would like to ask if there are reported long COVID in previously admitted pediatric patients. What are the common presenting signs and symptoms? I guess this is in relation to patients you have followed up over the year, no? So what do we know about long COVID in children?
So far, we have not. Yun po, the good news is we don't see much of the long COVID in children. Maybe remember our yung patients po natin medyo may ano rin sa PGH, no? They may not follow up, but we are doing a study on the long COVID in children. So we will actively follow up all these patients, no, especially those who had severe to critical, no, tapos nag-recover sila. We will see if there's really long COVID also in children. But so far po, lucky, yun ang ano namin, very good na hindi kami masyado nakakakita for now.
Okay, thank you. Thank you, Jing. That's good news. Raymond, meron ka pang question dyan?
Well, this one is more technical po, no? And I'll direct this to Dr. Ann. It's coming in from one of my former teachers and also former Deputy Director for Health Operations of PGH, Dr. Juliet Aguilar. The question reads, considering that the immune system in children is not as developed as in adults, do you foresee that the decreased dosing given to the younger children may require earlier boosting as the levels of immunity may not last as long as in the older children or adults po?
Ang hirap ng tanong ni Dr. Asyo. Sa ngayon kasi, Raymond, wala pa tayong datos eh. So, kailangan muna nating tignan. Lahat naman yan nanggagaling, sisimulan talaga natin. And then, ibibigay mo yung second dose. Hintayin mo kung ano mangyayari. Kasi as it is right now, sa 12 to 17 nga, sa Amerika, nagre-recommend na sila or nag-encourage na sila ng boosters eh. Ito, na mas bata pa yung bibigyan natin, subukan muna natin. Tignan muna natin kung anong ibibigay na datos sa atin kapag kinumpleto natin ang bakuna sa mga batang ito. Yun lang. Salamat.
Thank you.
Can I add? Raymond, can I add?
Go ahead, Director Eric.
Okay. Okay, there's waning immunity with the vaccinations. This has already been established. It starts during the 5th month after completing the vaccination. That is the reason why booster doses were recommended. But of course, we are gathering more data out there so that we can have a full understanding, especially the impact of Omicron on potential immune escape.
Thank you,
Okay.
Director Tayag.
Thanks. Meron ako, Raymond, may nakita
Sige,
akong
go
maganda.
ahead, Dr. Susie. I'm
From
consolidating.
Leilani Nashon, and this is because I also saw this in the chat, no? I'd like to ask po regarding kids with special needs. What will be the setup for them? Do they need to line up? Is there a priority lane for them? There was also a question earlier about in the chat about children with autism. So how are we going to, how are we organized to help children with special needs? So I think that's for Nika.
Yeah, thank you. Instructions we provide to the vaccination sites, no, that they have to be wary of the specific situations wherein we have to facilitate better. So some of the things that vaccination sites do is have priority lanes. Some also have dedicated days. Some do house to house. So really, these, especially these are operational concerns. We leave it to the sound discretion of the vaccination site. And palagi naman po yung ating regional office nagbibigay din ng advice sa kanila. But definitely po, we do advise, especially for those who would have to have special considerations to be prioritized, especially when they are already in the site. Thank you.
Okay, thank you. Raymond, ikaw naman.
Dr. Anika, there are I'm consolidating just several questions into one here. The theme of all of the questions is regarding how to make it more enticing to the children para magpabakuna. May involvement ba ang mga children-related organizations, the use of theme parks, amusement parks, fast food chains, etc., and schools in the rollout, what's the role of teaching and non-teaching personnel, that sort of thing. Go ahead.
Sige. Siguro I'll start answering this question by confirming that the planning process is multisectoral. No? So especially with our National Vaccines Operations Center, we do have private sector there. We have our fast food chains helping, and they've done a lot of help, especially for the adult vaccination program. No? So definitely, especially these scale-ups will happen as we progressively roll out pediatric vaccinations. No? So this is, as I mentioned, this will be in a phased approach. So in the first few weeks, we will be starting with a couple of sites first to see if there will be additional implementation concerns we have to address before a more larger rollout. And similarly, like what we saw in the adult group, kapag parang pulido na no, lahat, lalo na this is a new group kasi, a new population, that's when all of these demand generation activities will come in. Siguro mag-additional note lang ako dun sa mga theme parks and So currently in our national guidelines, we also have specific rules about when to allow activities in these areas. No? And especially these will be for lower risk, lower alert level areas. Because of course, yung mga issues then of possible crowding and ganyan. So definitely these can be explored. Yung sa schools, we've actually have discussions already with Dept to do that once we go to the expansion phase. And of course, once mag-resume ang face-to-face classes. No? So definitely all of these are in the works. Yun lang po, I go back to the phased approach. Now, we won't expect that maybe in the coming weeks. Because we still want to try out first in a couple of sites, especially for this younger age group with a different formulation. Thank you.
Yeah, thank you. Raymond, I found a good question here. And I've actually been asked this question kasi maraming nagkaka-COVID ngayon, at maraming buntis na nagkaka-COVID. So the question is from Maria Victoria Jimenez. An unborn child in the womb is affected by COVID-19 virus if the mother is positive. So this is probably for Doc Mean.
Ma'am Mean, idadagdagan ko lang din po, no, kasi may question po regarding breastfeeding. Na ipapasa rin po ba yon yung true breastfeeding?
Yung number one na tanong, ang tanong po ba is may transplacental transfer po ba ng
yeah.
Yes po,
virus?
yes ma'am. Opo,
Yeah.
correct ma'am.
Yes.
Okay. So far kasi wala pa akong nababalitaan na parang may congenital COVID dahil nakuha sa ina. Merong mga perinatal. Ilang araw pagkatapos ipanganak yung baby, nagkaka-COVID. That's perinatal after birth. Yung breastfeeding, actually sa totoo lang po, ina-encourage pa nga po namin yung mga nanay na i-breastfeed yung baby kasi nakakatulong po ang breast milk na kahit papano magkaroon ng panlaban yung baby. So we do not discourage breastfeeding dun sa mga mommy na positive and then yung ihiwalay mo yung baby. I think that's also the recommendation of the society concerned about yung sa mga OB ba yun, Jean? Mga sa POGs? Yun. So, yun po, Dr. Susie, yun po yung kasagutan ko dun sa mga katanungan nila.
Nice. So, no, that's very important information. No? So, if you're pregnant and you got COVID, you don't have to worry. Marami kasi ganun, nag-worry talaga sila kasi buntis, tapos nagka-COVID, and they don't know what to do about it. So, don't worry. So
Susie?
Yeah, go ahead, Eric.
Okay. Alam mo, isa sa eligible population na mababa yung vaccine coverage, yung pregnant women.
Okay.
Ang baba, wala pang 30% yung nababakunahan sa kanila. Kaya nga, siguro ito yung tamang platform para paalala sa pregnant women. Magpabakuna pa kayo, lalo na at start ng second trimester. Ang nire-recommend nga sa third trimester kasi you confer protection to your baby. Tapos Susie, may naisip ako, ang maaaring maging malaking sagabal dito sa pagbabakuna ng 5 to 11 pag ni-roll out yan, naisip ko ay yung mask. Kasi di ba kanina sa presentation, kailangan may mask yung mga bata. Yung mga masks natin abundant sa mga bata, yung size na po yun. Kaya ito ay dapat paghandaan. At yung sinabi ni Dr. Nika na yung mga may mabuting kalooban dyan, yung mga sa private sector natin, ay isa to sa maaaring yung pag-isipan at baka matulungan nyo kami sa DOH, yung mga pamalang lokal dyan, yung sa mga bata, lalo na't lalabas sila ng bahay at pipila para magpabakuna. Over to you, Susie.
Yeah, thank you very much for that, Eric. Yeah, go ahead.
Yes, support ko lang yung kay Ma'am Mean kanina. So that's why we do the testing for these babies nga o for after being born, no? And we have seen nga po, it's usually perinatal after birth na yung exposure nila because maybe the mother or the other household members are infected. But for breastfeeding, lahat po itong mga babies namin ito sa PGH, we do rooming in para talagang makapag-breastfeed lahat ng mothers. So we really encourage breastfeeding. And there are several studies already showing that breastfeeding is safe, no? Kaya po even if you're infected yung mother, and it has more benefit, no, than the risk of but still please follow the infection control. Nakamask pa rin si mommy kung kung infected pa rin siya or symptomatic. Nakamask, wash your hands, and then pagka basta lagi lang po as on demand na kung kailangan niya magpasuso, talagang dyan lang niya kukunin si baby para magpasuso. So that's please immunize, sabi nga ni Ma'am Emma. Please. And in PGH data, 80% of these mothers who give birth, no, and they are positive, they're unvaccinated. So very, very nga po talaga na we really want these pregnant women to be vaccinated.
Okay, so that's a very strong message, no, for our frontliners who are watching. We've been emphasizing vaccination of seniors, But I think what we're saying, what we're hearing from our doctors here is we have to take a special effort to have pregnant women vaccinated. I've also heard of a lot of women who are breastfeeding who don't want to get vaccinated. So hindi po, no, dapat po nagpapabakuna kayo at narinig nyo na sa mga dalubhasa kung bakit, no. Raymond, over to you. Meron ka pa nakuha dyan?
Thank you, Dr. Susie. So, I'm just consolidating po yung mga questions po, especially for from a public health perspective and policy-wise. Meron po dito that there are two questions, policy-wise questions po. One coming in from Dr. Emalianto. If parents are not available for the consent, who else are allowed to give consent? And the second question comes from Dr. Lulu Bravo, former NIH Executive Director. Are pharmacists going to be allowed to give vaccines to the 5 to 11 population? Dr. Nika?
Okay, thank you, Dr. Raymond. So yung first po, no, usually we follow yung, meron po kasi tayong legal rules about kinship, no? Kung sino yung mga pwedeng sunod-sunod. I believe that's in the family code. I can't go lang into the details, but that's usually followed, and that's also what the SWD follows, for example. Ang naalala ko at the bottom of that hierarchy of list is if wala talaga at the end of the day, a DSWD representative can be the guardian of the child. No? The details naman na lang po nito, you can see in the guidelines when it is going to be released. Doon naman sa question about the pharmacists, right now, the rollout in pharmacies is currently limited only to healthy adults. No? So at this point, hindi pa po, no? Especially for our child or for our children, that may be something that can be explored in the future. But right now po, in terms of policy, hindi pa po siya allowed. Thank you.
Okay, thanks. Doc Nika, let me just follow up. Oh, Eric, go ahead. Go ahead, Eric.
Oo. Kaya nga importante, Susie, na habang naghahanda tayo sa pag-rollout sa 5 to 11, kami ay nananawagan sa Department of Health, kami ni Doc Nika ngayon, sa mga pediatricians natin, sapagkat malaki-laki rin yung bilang ng mga batang babakunahan, over 12 million. So, kagaya niyan, hindi pwede yung mga pharmacy. So, kakailangan talaga natin ang marami po sa ating hanay para na sa ganun mag-volunteer po at magbakuna. Over to you, Susie.
Okay, thank you very much, Eric. Nika, follow up lang, no? I think that question about kung wala yung nanay, sinong pwedeng magbigay ng consent. Maybe we should have very clear instructions to families because of the number of OFWs we have in our country, no? I mean, the general public will not read the guidelines or will not go through the detail of that hierarchy. So siguro magandang talagang malinaw yon na pag wala si nanay, pwede si tatay, susunod pwede si lola, pwede si ganon. Now, this is very important information because if we just say read the guidelines, I think that might be a big barrier for the family to give consent. So it's good to know na meron tayong listahan, but I think we need to be very explicit about sino talaga yung pwede. And our OFWs will really appreciate that. That can be disseminated through the Department of Foreign Affairs, something like that. So anyway, okay, Raymond, one last question, then we go to our
this one question is a little bit interesting just because this is a question that we've gotten numerous times, not just for this. So, for the 12 to 17, ang binibigay po ay Pfizer at Moderna. But for 5 to 11, Pfizer pa lang po ang binibigay. So, the question coming in from Emil Villanueva, why is Moderna not yet approved for that same age population? And do we know if it's already being reviewed by the Food and Drug Administration? Thank you.
Raymond, ako siguro, and then
yes.
our experts can actually also input, no? But actually globally, yung mga vaccines na pwede for lower than 12 are actually Pfizer, Sinovac, Sinopharm, and a brand we don't know, Soberana, which is the one made by Cuba. So Moderna actually has not yet in other parts of the world, at least to my understanding, have a formulation for 5 to 11. So that may be the reason why it's not being implemented. No, the other vaccine brands, as I mentioned, I understand are also being reviewed by the FDA. But at the end of the day, we will be rolling out based on what has been approved by the FDA on this. Thank you.
Okay, Raymond, I think we're going to give our audience 5 minutes back of their time. Maybe before 2 o'clock, yung aking New Year's resolution na matapos ng empunto, 2:00, no? Pero sige, sagutin na natin, Raymond, yung fun quiz mo. Go ahead.
Okay, so for our fun quiz for this webinar, the 2 questions, may we have the mentee. Okay, there we go. 2 questions. Sino po ang dapat mauunang bakunahan sa mga bata na 5 to 11 years old? Ang options po natin, batang may comorbidity, batang mga anak ng frontliners, so batang nauna sa listahan ng LGU, at batang mga pumapasok sa eskwelahan. So obviously, we'll ask this to the pediatric ID specialist, Ma'am Mean. Can you help us out?
Raymond, sa tanong na to, ang uunahin natin, yung batang may comorbidity, and then susundan natin yung batang mga anak ng frontliners.
Thank you, Dr. Bunyi. And then for our second question, you've already heard this, but we'd just like to reiterate kasi this is one of the, we still receive questions with regards to ano po binibigay sa 5 to 11, but maybe we could ask Dr. Jing Pagcatipunan, alin sa mga sumusunod na bakuna ang aprobado ng FDA para sa mga batang 5 to 11 years old? Dr. Jing?
Well, our local, no, so kailangan pong sundin natin yung ating sa bansa, no, that is available and approved. So that's just the Pfizer for now.
Okay. Thank you so much, Dr. Jing. Dr. Susie, before we go into our evaluation poll, TVUP will be playing our Stop COVID Deaths shorts, yung ating mga short videos po. Meron pong inihanda. If you go to www.youtube.com, meron pong mga short videos. Hindi po siya literal na shorts, pero short videos po siya, snippets ng ating mga webinars para po mas easily consumable, maikli lang po ito, and something that if you go to YouTube or you're a YouTube, madalas po kayo sa YouTube, mas makikita nyo po siya palagi at sa very very quick videos that's really a clip from the select webinars that we have had. So while our research speakers are essentially contemplating and gathering their thoughts for their final messages for our audience, may we have on the screen the evaluation poll for our webinar for this afternoon.
Hopefully it's gonna work, ha? Raymond, hopefully it will work.
Ito po ang aming, yun, okay. Sige. We have 5 questions. I'm just waiting for the attendees, now numbering more than 1,300 to enter their answers. There we go. Okay, it's working.
Nobody should touch the end poll. Nobody touches it, okay?
The end poll. Yes, correct. Thank you, Dr. Susie.
The
first question, it reads, the panelists demonstrated thorough knowledge of the topic. It's a 4-point Likert scale, strongly agree, disagree, and strongly disagree. Something is happening again. Anyway, please continue to answer your...
Sige.
The second question, the panelists were well prepared and organized. Number 3, panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. Okay. While we're trying to make this work, Dr. Susie, I'll turn the floor over to you.
Bakit ganon? Sige, okay. Sige. Anyway, it's working na. So nobody touch anything, no, para hindi ma-frustrate yung ating audience. Okay, so we're going to have our parting words for audience, and as you know, our audience are frontliners. I think we would like to hear from our guests what your main message is for them in relation to preparing for vaccination of children. So we're going to start with Department of Health, Dr. Nikki Howe. Go ahead.
Thank you, Dr. Susie. Well, I think what I want to tell all of our frontliners is we all understand we're now at the second year of the pandemic, no? So all of your work has been really valuable, not just in terms of vaccination, but even in response. And this is the light at the end of the tunnel, no? Protecting everyone, all the age groups, will give us more confidence to really slowly reintegrate back into our work. So I hope we all have your support to continue to implement all of these. And also please be rest assured po, no, na especially sa DOH and our office at the Disease Prevention and Control Bureau, that everything that we do, especially in terms of our policies, are guided by evidence and are done in consideration of our countrymen and of course of our health sector and our frontliners. So thank you very much po.
Thank you very much, Nikki, for joining us. We'd like to have now a message from the Philippine General Hospital from Dr. Chiong Pagcatipunan. Jing,
Hi.
sa'yo na.
Yeah, well, as a frontliner myself, sabi nyo nga po, hindi ako natutulog. Obvious ba? But I really want to share that the data from our end, no, as a frontliner, to encourage everyone that we are doing our best, no, to manage all this and give you the data, our local data, so it can support whatever program our DOH will be implementing. So we ask for the vaccine, and that would please support, no, vaccination. And also as a pediatric infectious disease specialist, as part of PEDSP, also we are always here to help everyone know about the data, no, and also for the research. So please support vaccination, not only for the kids but also for the adults. Thank you very much.
Okay, thank you very much. This is Dr. Chiong Pagcatipunan of the Philippine General Hospital. Now we go to Dr. Eric Tayag. Eric, over to you. Gusto na si Eric? Did we lose Eric?
Magandang hapon
Here.
po muli at maraming salamat po at binigyan nyo kami ng pagkakataon na mailahad sa inyo po ang mga kaalaman. Caution lamang po, ang mga nilahad ko po sa inyo kanina ay maaaring magbago sa mga susunod na araw. Habang abala po tayo ng madagdagan ng mga Pilipinong mababakunahan, yan po yung mga batang 5 hanggang 11 taong gulang, huwag nating kalimutan na marami pa pong hindi nakakatikim ng kahit unang injection. At yan po ay kailangan nating pagtulungan, hanapin, kumbinsihin, para na sa ganon sila ay makasama na po natin sa fully vaccinated. Bagkos baka kailangan pa ng booster po. At sa inyong mga frontliners, saludo po ako at kaya nga ako sa aking sarili po ay may ambag po ako. Ako po ay patuloy sa aking pagbabakuna hanggat maraming opportunity po dyan. At ako po ay natutuwa sapagkat nagagawa ko po yan na makapagbakuna sa mga kasamahan ko rito sa Central Office at sa marami pang iba sapagkat hindi po lahat na yung nabibigyan ng ganitong pagkakataon para magsilbi, lalo na ngayon sa panahon ng pandemic. Sa mga kasamahan ko po sa inyo, huwag po kayong mangamba kung sakaling kayo magvo-volunteer, kailangan namin kayo sapagkat paano may mababakunahan kung walang magbabakuna. Salamat po. Thank you, Susie. Thank you, Raymond.
Thank you very much, Eric. Well said. Okay, and let's finally our co-host for the webinar. We'd like to call on Dr. Ann Bunyi.
Doktora Susie, simple lang po ang aking gustong ipahayag na ang mga bakuna ay mabisa at ligtas para sa mga bata. Yun lang po ang gusto kong iparating sa ating mga healthcare workers at maiparating. Yun lang po. Maraming salamat po.
Thank you very much. Thank you to all our panelists. We have a brief synthesis by the Dean of the UP College of Medicine, Decano po namin sa UP. We'd like to welcome Dr. Charlotte Cho. Charlotte, go ahead.
I cannot start my video. Yeah, good afternoon po at maraming salamat sa pagkakataon na ito na makasalo kayo dito sa Stop COVID. Ako po ay magbibigay ng konting synthesis. So we actually started with the opening remarks of Dr. Ann Bunyi, who is actually the president of PEDSP, who gave us a background on the vaccination rollout in the past 2 years and even highlighted that cooperation and collaboration will really be needed for the vaccination of the 5 to 11 years old population of children. We actually thank PEDSP and PPS for the joint position statement on the vaccination in children. Dr. Enrique A, as usual, gave a very comprehensive and animated presentation with a review of the global COVID status cases with about 326 million COVID cases worldwide and about 5.5 million deaths, with USA, India, Brazil, UK, and France as top 5, and the Philippines ranking the 20th with 3.2 million cases and 52,000 deaths. So COVID-19 is now ranked as the second most common cause of death in the Philippines, second only to ischemic heart disease. He even highlighted that children are all susceptible, that 18% of lab-confirmed COVID cases are actually among children, and that children can always transmit the virus even if they're asymptomatic. And therefore, this prevalence can actually increase with increasing age. And ang importante po ay sinabi nga niya ay masking, because inconsistent masking is really the most common cause of transmission and not school attendance per se. At while death is rare, 133 deaths in 100,000 cases in 2021. Maliit nga po yon, pero sinabi rin po niya na baka nga merong long COVID. So kailangan pag-ingatan pa rin ho ang mga bata. So governments really need to contextualize these vaccination programs given the supply constraint vis-a-vis the other vulnerable populations, especially the elderly who have not received their vaccination in other groups. So lastly, just reminded us that children really need to be prepared for the jobs. Hindi naman to pwedeng dadalhin nyo lang siya na hindi nyo piniprepare psychologically ang mga bata kasi baka hindi pumayag. Mag-iiyakan sila siguro sa mga vaccination sites at magkakapilitan tayo doon. Medyo mahihirapan ng ating mga healthcare workers and frontliners sa vaccination sites. Dr. Nika How actually already outlined to us how they will operationalize the vaccination and even presented to us the special considerations and preparations being done by the DOH for the rollout of 5 to 11, saying that there's going to be a pilot launch and maybe an expanded rollout given the experience of the initial rollout. Marami pa po tayong kailangan paghandaan. 12.5 million ang ating 5 to 11 years old na kailangan natin bakunahan. So hindi po biro yan. At so maraming salamat sa TVUP, kay Director Gigi Alfonso, kay VP Nemi Pernia, sa ating dalawang host, Susie Pineda and Raymond. Talagang bilib na bilib po ako sa kanila. Number 84 na po tayo, pero nakita naman po nyo ang kanilang energy ay nandiyan pa rin. Maraming salamat of course sa speakers natin, kay Dr. Bunyi, Dr. Eric Tayag, Dr. Jing Pagcatipunan ng PGH, at dito kay Dr. How. Kay Dr. Pagcatipunan, ay yung kanyang mga sinabi sa atin tungkol sa PGH experience ay isang napaka-importante kasi ito yung mga ebidensya na kailangan gamitin natin para wag tayong matakot at lalo pa tayong pag-ingtingin ang paghaalaga sa ating mga bata. Bagamat sinasabi nga niya po doon sa kanyang presentation na 3 lang yung nagkaroon ng multi-system inflammatory syndrome, no? Nakita niyo po after 1 year, nag-4-fold increase yung MIS at nag-3-fold increase ang may moderate COVID. Kaya ho, dumadami. Kaya ho siguro kailangan natin pag-isipan mabuti itong vaccination. So maraming salamat po. Again, at ako ay nabigyan niyo ng pagkakataon na i-synthesize ito at magbigay ng closing remarks. Lagi ko po sinasabi, kaya natin to, mga Pilipino, magagaling tayo. Kailangan lang natin talaga maipaliwanag ng mabuti sa ating mga kababayan kung gaano ka-importante ang bakuna at huwag silang matakot dun sa sinasabing mga nakakatakot na reaksyon o side effect ng vaccine dahil kailangan magtiwala sila sa ating gobyerno, sa ating DOH, sa ating mga frontliners na nagbubuwis ng buhay. Dahil ang talagang gusto natin ay makaraos tayo ng maayos dito sa COVID-19. At wala akong kaduda-duda na pag binakunahan natin ng 5 to 11 years old, sila ang sa kanila nakasalalay ang kinabukasan nating bayan. So kailangan natin sila talagang pagtuunan ng pansin. Maraming salamat po.
Okay, thank you very much. That's our Dean, Charlotte Chiong of the UP College of Medicine. Always very inspiring at napakahusay ng kanyang synthesis. Parang yung 2 hours natin ay nalagay niya sa isang sa isang maikling summary. So okay, next week, oh my, we have a good topic. Don't miss it, okay? And I'm sure you are experiencing this dilemma. Habang nagsusurge, anong ginagawa para sa mga emergencies? Paano inoorganisa ang ating mga emergency room? Anong proteksyon ng ating mga emergency room workers, mga ambulance drivers? No, so ito po ay pag-uusapan natin dahil marami pong, kahit naman nagko-COVID, nagkakaroon pa rin ng mga emergency dahil sa iba-ibang mga sakit. Guest po natin ay President of the Philippine College of Emergency Medicine. Meron po tayong mga emergency room chiefs of the Philippine General Hospital, East Avenue Medical City. No? So pag-uusapan natin how to manage emergency room in the time of COVID. Don't miss it and invite all your friends in the emergency departments to join us next Friday. Raymond, over to you.
Thank you so much, Dr. Susie, and thank you for that wonderful synthesis and closing remarks from College of Medicine Dean Charlotte Chiong. We'd also like to thank the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out this quality content po and be part of our growing credible online community po. And finally, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel for your convenience. It starts po everything, all of our webinars from webinar 1 up to webinar 83, and then during this weekend, webinar 84 po. Sana po you'll have the time to watch them on the playback at mas matututo po tayo ulit with all of the learnings and the wisdom imparted by our resource persons po. Gaya po na nasabi ni Dr. Susie, mahalaga po yung ating topic for next week po, especially for those essentially po na in emergency situations, we may be able to touch on those that have been affected by Typhoon Odette. So paano po ang kanilang kalagayan? So please watch out for that webinar. I hope you can join us again next week. This formally closes our webinar for this week. We look forward to your company again next Friday from 12 noon to 2 p.m. It's a date.
Together, we will stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long will this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, Do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others bend before my fears, the others laugh before my tears, but right behind the mask I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold the